Hello, dear viewers. I am Dr. Rohit Kumar, a senior consultant neurosurgeon practicing in Hardwar, Roorkee area. Today, our point of discussion is regarding seizures, and our topic of discussion today is once an epilepsy is diagnosed, what are the precautions one needs to follow? So, the first step in every disease or particularly taking relation to the seizure control, is the first we should have a good seizure control to lead a risk-free life from seizures. So, what are the basic things I will discuss today? Every patient diagnosed with seizure, his patient along with his family must have a working knowledge of the disease, what they are dealing with, and what are the steps to be taken when these things happen with the patients. So every patient and every family member should be counseled in detail, make the disease understand to them, and they should knowing what are the precautions and what are the steps to be taken when such events happen with the patient. Number two, every diagnosed case of seizure patient should have a medical ID band. In our country, we can have a medical ID card that patient will carry in his wallet, which will have the basic information like patient's name, age, sex, his detailed contact address, his numbers to be dialed in case of emergency, what disease he is having, what type of seizures he is having, and he or she is having, and the drugs he is on. The next step is that every patient diagnosed with epilepsy should know about his medications, what medications they are taking. They should be knowing about the common side effects of the medication, which can be dealt at their own level, and the some serious side effects which the doctor or the care provider should inform them. If such things happen, they have to seek the medical advice as soon as possible. And if they are not satisfied with the medications or any drug side effects there, they should seek medical attention and get the drugs changed without stopping at their own level. Next step important is to any patient with diagnosed with seizure should identify the triggers. There are certain things which a patient diagnosed with seizure should avoid. Number one is they should avoid missing the medications. Number two, they should be avoiding overexertion, mental stress, fatigue. They should maintain a good sleep hygiene. Sleep deprivation is one of the most common cause of patient getting seizures. If the patient is indulged with any alcohol or any illicit drug abuse, they should avoid this thing. They should stop this doing smoking, alcohol, and taking drugs. They should be avoiding going to open fire spaces, water bodies, to heights when they are unaccompanied. They should be avoiding driving also. The next step is that what are the common precautions they should take at their home levels. If the patient is staying alone, he should see that all the any sharp corners of the houses have been padded completely. There should be non-slippery mats should be applied in floorings. They should have adequate lighting when they are going into their doing night hours. They're going to washroom or something there. While bathing, they should avoid the bathtubs. They should do use showers instead of using these bathtubs. They should not keep the open taps running open. The doors should be both way opening. If such things happen in house, if a patient gets a seizure and he's in disoriented space and is alone, first thing he should do is he should not be going to the open staircases or heighted railings or going to open fire spaces like fire houses or any open heaters places or kitchen where he should close the door, remain inside. Yeah. If such thing happens near a water body, we should help the patient to get his face up on the water, above the water, and he should be removed as soon as possible from the dangerous sources. And the next important precaution is that a patient should be avoiding confusing myths regarding the disease. There are lots of myths regarding disease that the disease is a mental illness. That once a patient with epilepsy is always a patient with epilepsy is an incurable disease. These are all myths. The patient should be clarified. The number one myth is that when the patient is having a procedure, often people used to put some things in their mouth. It should be avoided. Patient should be turned to one side and should not be given anything in the mouth. Patient should not be left unattended. His head should be protected. And if he is getting any dangerous elements around or surroundings are dangerous, patient should be immediately removed from that side. And the most important, the caregiver who is alongside the patient should remain calm and sensitive to the patient's need. And the next important precaution is that the patient should maintain a good sleep hygiene because sleep deprivation is a major cause of triggering seizures. And also the patient should avoid going to flashing lights, flickering lights, strobe effects. This causes photosensitive epilepsy. So these are the basic things because precaution a patient should follow. And closing my remarks, patients should be have some important things like he should be sensible, avoid triggers, be healthy and happy always, manage stress, maintain a good sleep hygiene, and have a tight control of his sugar levels and blood pressure. And also, if he is a diabetic or hypertensive, and have a good seizure control to lead a happy and healthy life. Thank you.